Hi, I'm Dr. Manish Singhal and I'm a medical oncologist at Apollo Hospitals, New Delhi and Noida. And we will be discussing about colon cancer or colorectal cancer, if we may say so. And this is basically a cancer of the large intestine. It is a quite common cancer in the Western world, but it is much less commoner in the Indian subcontinent. And mainly this may be attributable to our eating habits and eating of more vegetarian or less of red meat diet. So we will be discussing about the incidence of colon cancer, which is about 4 to 5 new cancer cases per 1 lakh population per year in this country, whereas the incidence in the Western world ranges between 20 to 25, which is 5 times higher. So we'll discuss about the risk factors. There are certain risk factors which are modifiable and there are certain risk factors which are non-modifiable. The non-modifiable risk factors are age. Of course, the cancer incidence of colorectal cancer increases with age. So it is a disease of aging population. Inflammatory bowel disease, there are certain diseases such as Crohn's disease and ulcerative colitis. These are autoimmune disorders of the large intestine which can predispose the large intestine to develop cancers. So those patients who have history of inflammatory bowel disease or Crohn's or ulcerative colitis, they have higher chances of developing cancer, and generally these patients are advised to undergo repeated or regular colonoscopies. That is a test which is done to see the intestines from inside or the large intestine from inside. Some patients have history of polyps. These are certain nodules, non-cancerous nodules in the large intestine, and those patients who have history of polyps have also got higher chance of developing colon cancer, that is large intestine cancer. And lastly, not the least, those who have family history. Sometimes colon cancer can run in families. So we call it Lynch syndrome, and this is a syndrome because of which there is predisposition to have cancer, and in these patients or those who are Lynch carriers or there are genetic mutations, these patients are or these individuals are asked to do colonoscopy right from the start of 20 to 25 years of age, every 1 to 2 years, and generally they will start developing polyps, and then some of these polyps can turn into cancer. The modifiable causes are obesity, that is motapa, and so one should strive to have a good body mass index and exercise regularly. Smoking can also predispose to have colon cancer. Alcohol, and especially alcohol in large amounts, can cause colon cancer. Lack of roughage or fiber less diet or eating of lot of junk food can also predispose to cancer. So all these things are definitely modifiable causes, and increasing or taking lot of fat in the diet can also predispose to large intestine cancer. So these are modifiable causes, and one can definitely change. Those who are genetically predisposed, even if they take care of these environmental pressures such as avoiding alcohol, avoiding smoking, avoiding obesity, working out well, they can, and taking lot of roughage and fiber rich diet, they can avoid cancer. Coming to early detection of cancer, so the major symptoms of this particular disease are change in bowel habits, unexplained weight loss, and sometimes they can have diarrhea, sometimes they can have constipation for long duration, sometimes bleeding in the stools or passing of blood in the stools, and gradually their hemoglobin can drop down and they can develop iron deficiency anemia. So there can be, or sometimes lumps and bumps and aches in the tummy or in the abdomen, which are long lasting. 1 or 2 days duration of pain or bleeding is not a symptom of cancer, so one must keep that in mind. To diagnose, whenever there is a suspicion of colon cancer, generally we do a stool for occult blood and we order a colonoscopy test, which is a simple test to be done. It is an invasive test, but a very simple test to be done, very risk free, where a scope is sent inside the anus and the large intestine is checked, and there and then a biopsy can be taken, which will confirm the diagnosis. Generally the staging process is done by doing a CT scan or a PET CT scan whole body, and usually this cancer is detected in early stages. Most patients will come in not very advanced stages, and surgery remains the mainstay of the treatment, followed by some chemotherapy in patients who have slightly advanced diseases. Many patients can avoid chemotherapy if they are detected early, and surgery alone can be a completion of the treatment. In rectal cancer, which is lower down, very close to the anus, sometimes radiation therapy is also used along with surgery and chemotherapy. As I said, that in early stages the cure rates can be as high as 85 to 90%. However, the cure rates keeps on dropping down as the stage becomes advanced. The good news is that in stage 4 colon cancer, about 20 to 25% cure rate is there, especially if it has traveled to the liver. And liver is the most important and the most common site. If it travels to any other part of the body, liver is the most common site. And even in stage 4 colon cancer, there is about 20 to 25% cure rates, because through surgical techniques you can resect that part of the liver where the tumor is. So I think it is best avoided and best prevented, and if not prevented, then early detected and rightful treatment at the right time can result into cure, just in case somebody is unlucky to get this type of disease. So wish you all the best and a very happy and healthy 2021.